Hello and welcome to another episode of Ashgrove TV. I'm Anna and today I'm joined by sports injury and rehab specialist Jay Sheridan. We're covering running injuries this afternoon because we know there is a massive amount of misleading and inaccurate advice wafting around social media. So whether you're training for your first 5K, preparing for a marathon, or just enjoy getting out for that run, this show should help you understand what the common problems are, what causes them, and what you should do about it. And also, when is it time to get some help? So, Jay, let's start with a possible myth, and obviously welcome
Hello,
again.
Anna.
Hello. So do runners get injuries because they run?
It would be easy to say yes, because that's where the injury will normally show itself. But there's a lot more to it than that, okay? And if we break it down a little bit, often it's when we have a sharp increase of activity in running.
Yes.
Or a couch to 5K where somebody hasn't done other work, which would be strength conditioning, so some weight work or some other exercise to make them strong enough to absorb the forces that running brings, which are quite dramatic actually.
Yeah.
So no, it's not easy to say. You know, people go, my partner tells me I'm always injured because I run. No, there's more to it. There's more to it than that. And so when a patient comes in and says to me, oh, it's no good for me, this running. And that's a real common one for me. And patients will come in and say, this is bad for me. It's really not. There's something else causing that injury, and there's so many things. And is it often
the running that's then presented an underlying problem?
Yeah.
So potentially the running's not causing it, but there was an issue
it's
there.
Exacerbating it just a little bit, and probably an underlying issue. And a lot of it actually tracks back more recently to things like COVID times, where people started to run more because they couldn't go to gyms and they started to exercise. We have different working practices now. So, you know, the remote role, working from home, or hybrid role where people are in a really awful desk position and they're quite sedentary. Yeah. And their muscles are shortening and their joints don't like that either. Yeah. They then want to run, their body needs to be in this lovely flowing motion, but they've kept their body in a bad position for too long. Right. So more often than not, that's a big problem for runners. So we encourage them to get up from the desk when they can, to move around, even little contraptions like little pedal devices we use under the desk, or even little walking treadmills that they can do on a standing desk or sitting, just to keep movement and try to keep getting them to reset their posture. So no, it's not fair enough to say, does running itself cause the injury? It's like anything in life. If you dive straight into something without having the preparation before, you are very, very likely to get injured,
And so what are the top maybe 5 injuries that you would see?
Oh, wow. So we better do them in the order that they're seen as being true. Okay, so runner's knee. Yep. Okay, which is pain around, if you like, the front of the kneecap, sometimes to the outside, sometimes to the inside. Okay. It's often caused by a sharp increase of running, actually. That is one where somebody just enjoys it a bit too much and suddenly they're running every day and they're overloading, there's not enough time for recovery. But what we will see there, the classic question I'll firstly ask the patient, do you have pain walking downhill or walking downstairs? Okay. If yes, if they've got a slight little bit of puffiness around the knee, then yes, we would call it a runner's knee. More medical jargon, but we don't need to know that. It would call it runner's knee. Okay. Where it gets a little bit more interesting is that a lot of the time it's not a bona fide knee problem. It's because they're not fixing enough on the gluteals and muscles of the bottom. So they're not strong enough around the hip joint. And there's more movement coming into the knee, or their foot position is not correct, both when they hit the floor and when they leave the floor. So the mistake to make is to just treat the knee and not to what we might call a biomechanical assessment, where we're looking at how they move. We're testing their muscle strength, see what their strength is like in the groups. Is it different? Is the injured side different in the strength than the uninjured side? All giving us clues of how to not only fix it, but keep it fixed. So that is the one always at the top.
Any others?
Many. Many. And obviously, without sounding silly, they all tend to be hip downwards. Yes. Okay, so if we actually look at the hip, we can see that we have we can have a bursitis in there, so a sac of fluids that we have around all of our joints to lubricate the joint, support the joint if you like, and nourish it. We've got a lot around the knee actually, so on the front of the knee, rather sexist, it used to be called housemaid's knee. If you remember the old footage of somebody on the doorstep cleaning, because you'd press these things, they don't like it. Okay, so get one on the hip, which is normally linked with a tendonitis, so a tendon that inflames, normally a dual diagnosis, often then thought to be a hip joint problem, but rarely is.
So that is an inflamed
It is inflamed. So again with that one, that will be probably prevalent when that person's sitting as well, not just when they're running, but when they run, it will normally be uncomfortable when they run as well. It's not one of those where they can run, get away with it, and later that evening it's painful. It's quite debilitating. So one there, if we work down a little bit more, we've got good old Achilles, which again, this is often mistreated, the Achilles, because everybody will go straight to using, say, a laser that we have at the Ashgrove clinic, which is hugely effective in the repair of it. But they don't look at the calf group, and of course the Achilles comes from the calf group. So you'll normally see, this is, again, there's always polar opposites, either too much of a stronger calf group, so it's too short or too tight if you like, or it's not strong enough at all. So it's not supporting ankle joint, and actually it's probably not supporting the knee joint as well as it could be as well. And
would the pain be at the back of the foot?
Yeah, and that's
very
hence
pain.
The problem is that we go exactly to where the pain is. Now look, you know, say if somebody kicks you on your Achilles, that's where the injury is. That's where you sustain the injury. But often, although that area is showing an injury sign, it again is coming from somewhere else, and even hip, again not being strong enough. Also in Achilles, most of the time footwear is incorrect. And that's a big one.
I want to actually I do want to talk about footwear, because that's come up in our questions. So I can ask you about that. So what about one I see in my clinic very often is plantar fasciitis. So is that another one that you see often?
Me too. It's a huge injury. Both in runners and walkers, people that like their hiking or a little bit more intense about their walking. And again, it can start for a few reasons. The most obvious reason is the footwear. So there's not enough arch support. So if we think of our inside arch, so say like the summer we're having at the minute, where people are going to be barefoot a lot, or they're going to be in a flip-flop with no support, we start to stretch on the plantar, and that heel, like say imagine in a running shoe's got cushioning, you've got no cushioning on the heel, so we start to just bash that and put a little bit too much force through that. Now what we have to think about then is correcting that. So correct footwear. And whilst we talk about footwear, actually one of the biggest mistakes people make is buying really expensive running shoes when they're running, but not having a gait analysis. So that looks at the way the foot lands and how it leaves the floor. So they go and spend £150, £200 on a pair of trainers, and I've seen it a few times in the clinic, but the trainers are useless for their foot mechanics of how their foot operates.
And how would you go about having a gait analysis?
Well, we do it within the Ashgrove clinic, and they're bespoke orthotics, so they're made, we 3D image the foot on impact and on leaving. Now that would be strictly for people that really are struggling. And off the shelf, if you like, or something you buy on the internet is just not going to cut it. But running shops do it. I mean, now speaking out of turn, the gimmick normally is that your gait analysis is free if you buy the trainers. So there's that little buy-in to that. But to me, I always say to my running population that if you are running 2 or 3 times a week, you have to be in the right footwear. Not good, because good suggests to them Adidas, Brooks, all these, and there's many different brands now. Because what we must do, and whilst we're talking about the foot, and the problem is we say, if we look, here's the Achilles here, here's the plantar starting on the heel and running along here. So if this foot, so 50% of people that run are in a neutral running gait. Now that's good. That means the foot lands evenly, the force is distributed evenly, and it leaves the floor like that. 40% roll in too much. That foot rolls, and imagine that arch rolling in, the opposite of actually rolling your ankle, you know, that we've all done in a time. Arch comes in a little bit. In doing that, we have the stress along the inside of the heel.
And why would somebody do that rather than do it as it should be? What would be the reason?
It's normally, if you like, hereditary, or it's a construction thing of how they've been made. Often the parents have the same walking gait. It could be learnt through an ankle injury. So sometimes I've found when people have had repeated rolls of the ankle, to even put much weight on the outside, the ligaments around the joint, which protect it, tell him to stop doing that, and it tells the opposite to keep rolling the foot in. So it can be a learnt pronation, so we have to unlearn it, and that's where orthotics come in.
And poorly fitted shoes from early on in life? Could that be
most
something
definitely.
Progressive that you see over a period of time?
Yeah, most definitely. And also, not just poorly fitting shoes, the footwear people wear day to day, because people will come in the clinic and go, no, I've had my gait analysis, I'm in the right shoe, and they are. But how often are they in that running shoe compared to when they're wearing a rubbish flip-flop or walking around barefoot all day? Again, the percentage is too great, like sitting at the desk, too much of doing the wrong thing and just not enough of doing the right thing. And then when you're doing the right thing, the injury shows itself, except it was made by doing the wrong thing. Yeah,
because we very much talk about 80-20. Do the right things 80% of the time. Is that what you would recommend?
I'm familiar with that. Yes, of course. And it's always about little incremental changes with injuries and things. You don't want to flip someone's life completely on its head with their training or what they need to do day to day, because they won't buy into it. They'll be scared of that much change. So with anything, with exercise rehabilitation that we give, it's all slightly incremental raises. Really, to get them.
So if somebody is running and they experience pain, should they carry on running? Should they stop? What would your advice be?
Put me on the spot. Me personally, and I mean myself, would carry on running. And but let's break it down into the injury state of it. Okay, so if it is a niggle during the run, never really goes up from a niggle. After the run, doesn't really go up in pain, keep the person running, keep them conditioned, because if they stop, I mean, cardio fitness will start to drop within 2 or 3 days quite easily anyway, even in an advanced athlete. So we want to keep them active. Obviously, that changes, because you can have a scenario where somebody starts running, bit of pain, it goes, then towards the end of the run it really goes up the pain, and then for the rest of the day into the next day they're hobbling. That's where we need to reconsider whether they run or not. So I'm not being, kind of over the top, or what we do is we take a therapeutic risk with people, and that thing is that we keep somebody going as long as they can. And if somebody has an event on Sunday and it's important to them, do I give a textbook answer and go, no, you've got to stop running for 3 to 6 weeks? Or do I look at the environment and see if they can manage it, and then I pick up the pieces next week?
Yeah, because running for many people is more than just for the exercise. It's for a break, it's for getting out in the fresh air, it's for their mental health, it's for de-stressing. So that's the therapeutic.
You've got to look at that, haven't you? Again, you've got to look at the intrinsic, extrinsic, if you like, the psychological, the physiological factors. So we know that cardio exercise, alongside other exercises, produces, apart from in 1% of people, most people get serotonin or a dopamine increase. Which is why you'll, funnily enough, see runners' diet go in relation to your job. So if they can't run, they need a fix. And you tend to see runners will start eating carby, sugary, rubbish food, because their brain still needs that little bit of that kick which they can't get through the running. So that's a brilliant point. So it's a little bit from a psychological aspect. But look, if somebody's come into the clinic, knees ballooned, they've rolled their ankle, that's ballooned, then obviously they're not going to be running. But that doesn't mean we can't keep them active.
That was going to be my next question. So presumably you'd be able to make suggestions of other things that they could perhaps do that would protect the rest period that you're recommending, but actually keep them
exactly that. Just one of the guys just actually done his first run back today after 2 weeks. He's had a little bit of a minor knee problem. Now what we did with him was get him on a bike, which is not the same. It's not running, by the way. So when we go, we can mimic running through cross-training bike. We can't, but what we can mimic, and we've been doing it with this guy, and he's a slightly older guy. He's in his mid to late 60s, actually, but he's a really good runner. We've mimicked his heart zone rates of training. So he's training to the same extreme on a bike as he is when he's running. Okay. So whilst we can't mimic the running action on a bike, I can mimic his heart rate through exercise, and that's very, very positive, in line with him getting back to his running at that pace quicker than if I say, well, I tell you what, just don't do anything. Yeah. Just don't do anything. Do you know what I mean?
Okay. So brilliant. Okay, I'm going to have a little look and see what questions we've had come in. We've had loads come in, which is amazing. So Paul has asked, is it normal to hurt after a couch to 5K?
Paul, that depends what phase you're in of your couch to 5K. So I would presume you've just started. So yes, if he hasn't done that activity before, look at somebody, and I've seen a few of them recently, gardeners. They get out in the garden, they're bending more. Yeah. They get a bit of lower back pain next day, maybe for a day after that. Are they injured? No. Have their tissues just been a little bit more stressed than usual? Yes. Will they recover quickly? Yes, most of the time. So if we delve deeper into that, it is because I think Paul's body's getting used to maybe a newer activity, because the Couch to 5K is an app for people just starting running, or people that have been injured. So actually when people are coming back from injury, I often start them back on that app if they're used to it, because it's the friendliest app to use. I don't have any affiliation with it, but it is the easiest app to use for both beginners and people reintegrating back in, because we can run and walk until we're then just running.
Progressive program.
So regarding her, that would depend now. That would come down into if there's a specific area of Paul's body that is constantly painful post-running, we would be veering possibly into injury territory if that's the case. Yeah, okay. Or if he's, nicest possible way, if he's following the app correctly, or is it, oh, I'm loving it too much, so I'm going to skip that bit. Yeah. So it's a little bit like that to consider. Okay, and so self-care that you'd recommend at home? So, there's so much. Paul's hurting, what would you tell him to do from a self-care? One thing with runners, and you know, when I've been on the show before, people get sick of me saying these three words, but it's strength and conditioning is key. So if you look at the World Cups going on at the minute, right, football, do you think those gentlemen, or the ladies, cricket World Cup going on at the minute, for instance, do you think they both just play those sports for their training? It's a big bit, isn't it, the technical side? In fact, most of the time, there's a lot of fitness going on. So that is weight work, it is what we call plyometric jumping work, it is stretching, it is resistance bands, mobility. You need to be doing this stuff if you want to keep yourself from being injured. And actually, on a more positive thing than injury, get stronger at your running, because we can prove, in fact I've proved it many times, and when I start getting people to engage in squatting, in all these exercises to make the glutes and the leg group stronger, they get faster at the running. Right, because they can absorb more force.
And prevent the injury risk as well. And is that something that they can find information from seeing somebody like yourself, or where else could they find information around strength and conditioning exercises?
Really just me. No, I'm joking. Look, there's a wealth of information out there. But it's a bit like when you're at a running club. Everybody at a running club has a bit of advice for you, and that's welcome to a point, but it is normally based on their own injury experience, their recovery. And I always, as I mentioned earlier, you look at the extrinsic and the intrinsic. So really this stuff as practitioners we can control, and then having to trust that that patient will do the right thing when they're not with you. Okay, so yes, there's a wealth of information out there. Some of it, remember, are people just trying to be celebs for the day, but there may be some content there. I am honestly of the opinion you seek professional guidance from somebody with an injury. Okay. Because again, there can be underlying causes.
Yeah.
There can be underlying causes. Is the internet going to tell you that you may have a problem with your foot because you may be pre-diabetic?
Yeah.
You may have joint pain because of a medication you're on. Is you know, a blogger going to tell you that? Maybe they will, maybe they won't. But I think it's better to seek the professional guidance on it, because the one thing I wanted to talk about a little bit earlier, and I touched on it a bit, is that we will then go into what we call a load management phase with somebody who's injured. So we may decrease load when somebody's injured by a percentage, and that can be the intensity, that can be the repetition of what they do as well.
Okay, so just do less of what they're already doing. When you say decrease load, you're saying just reduce.
10% rule that you could take it. So we need rest weeks. So for instance, we're talking about runners. So we know that, say, runners follow a 16-week marathon plan. A lot more experienced runners won't feel the need for that, but if it's your first one, you should. But it isn't just like, I'm going to do loads and loads of miles and there's London at the top. It doesn't. It goes up, then for just 2, 3, 4 weeks, depending what program you follow, you actually lower your miles. And people can't get their head around that, because they're going, I'm going to lose my fitness, I'm going to lose my fitness. Now, what I said earlier about cardio fitness, going quickly, that's if you stop somebody completely. If they carry on just lowering the mileage, they've done so many miles on their training runs, it's in the bank, so to speak, they've still got it. And boxing is the same. So if you work with boxers and martial artists, which I do sometimes, it's getting them to slow down before a fight, because they think they still need to be going hell for leather in the training and the sparring. But actually we know they arrive at that event, and if we relate it to running, they arrive on that starting line fatigued, because they've overtrained, not overreached. Yeah. Overreaching is when we're pushing you to make subtle increases in your strength, fitness, whatever. Overtraining becomes serious fatigue, which can last for weeks to months on an athlete.
Right, okay.
So it's that subtle little load management. We load you up more, or for a week, because there can be all sorts of things. You're not sleeping well enough. We know now a lot with teens and ladies in the early 20s, menstrual cycles affect energy. So it's about dipping.
And ligaments?
Yes.
Yeah, so yeah, that's...
Well, ligaments is another massive one. When we go back to injuries, ligaments on the ankle, and ankle inversion is pretty common in runners that we call trail running. So they're running through fields, uneven ground, they're not on road running, and they can be very, very debilitating. But again, that often cause wrong footwear, again, wrong foot mechanics. We've got too much of the outside of the foot going on, too much of the inside foot rolling in. And if you're doing that over tens of thousands of steps, that has to be damaging, right, doesn't it?
Yeah,
there can't be anything positive comes from that. So it's about footwear, but it's also about protecting the person from having this injury, and that is done through sleep, strength conditioning, diet, all
hydration,
these things.
Is that
massively
critical
at the moment, isn't it? It's absolutely huge.
Yeah.
And so again, we've got great tablets that we know will, you know, effervescent type things you can put in your drink, the mineral replacements and things. Yeah. And all these things just keep the body in this state that it wants to be in, which is because you're going to stress it when you're running. So let's make the body as relaxed as it can be. Yeah. So the injury risk just goes down then. Okay,
and what about supports that you can buy on the internet? My daughter has every support that you can possibly imagine.
What does
she's a big footballer.
Is she a footballer?
So she's a footballer.
She'll have a knee support probably.
So, she has a knee, she has wrist, she has all sorts. But when I go and have a look, there is so many different types. So do you recommend supports for an injury, a knee support?
Lord, for certain things, if again, I always give my opinion and the evidence, because it's not like my word is God. There's different evidence for things, okay? There's a danger in certain sports. So when I worked with rugby teams, we know if we tape a knee, it's going to make it a target for the other players going to want to damage that knee, because they can see you've already got an injury there. It's quite cynical, isn't it? But that's how it goes. And we've also got to break it down to what is that support doing, because I don't think a lot of people really understand what it's doing. Okay, so ideally a support's there. I mean, you'll hear all this stuff like it increases blood flow and compressive force It does a little bit, it does.
Okay.
So in like your daughter supports, it will do that a little bit. A knee support, if it's an open, like we call a donut, so the knee's free, there's argument that when we talk about the runner's knee, it can centre the kneecap, the patella, if you like, and keep it in place, allegedly. Look, the long and short of it is, if a patient comes in and says to me, I know it's probably not doing much, but I feel like it's supporting me, keep it on then.
Yeah.
Keep it on. Nothing's terrible going to happen by wearing it, but you mentioned the L word, ligament word, a little while ago. And this is what worries me with them when they've got prolonged use, because the ligaments, which are really sensory things, tell us where we are in space and time, how much pressure we need to move. They get a bit distorted if they're getting this support around them all the time, so they're not really being able to move in their correct fashion. But I worked with 2 skiers this year, and you don't see this injury much in runners, but an ACL ligament, which is really famous in football and rugby more, and skiing a lot actually. We then use an orthopaedic brace, but that's something far more medical, and that is there to support, hopefully, depending where the ligament's torn, repair of the ligament. So if you're asking me about a brace support, yes. Orthopaedic support, yes, needed. I'm always of this opinion without being facetious. Can something 10 quid off Amazon really speed up your injury?
Yeah.
I doubt it. I doubt it. I'm happy to be wrong, but I doubt it.
And so at what point would you recommend they see a professional like yourself?
I think, obviously, if they come an absolute cropper, a bad fall or really bad ankle sprain, but then again, we'd probably direct them. I mean, we've got to be careful going, you need an MRI scan all the time, you need an X-ray all the time. I think we overblow that a little bit. But I think when somebody if they severely roll their ankle, or they're on a trail run and their knee gave way, with all this massive swelling, I'd say you probably want to get that checked out a little bit more hospital-wise for that. But when they come to us, for one, the injury's not going. And not only is it not going, it's becoming more prevalent, more painful, and it's stopping you doing something you enjoy. That's when you come to us. And if we can treat and help and rehabilitate, we will. If we think you need somebody else, we would advise you down that pathway as well. But I do think people are reluctant to come with their injuries, and some of the injuries are your little pathway into running, but speak to a runner who's never had an injury. They don't exist, because it is 2 things that injuries love. It's repetitive and it's intense, and that's a right injury model right there. But it's really when something's not going and it's then stopping you, that's when I want to get involved with somebody, yes.
And for anybody who's thinking of starting running, but worried about injuries, should they start on a treadmill or should they start out on the road, or is there no specific?
Now, the treadmill thing rages on and on, because there's no 2 ways about it that there's more cushioning with a treadmill. In fact, sometimes when I'm getting people back to running who have been used to running outdoors on road, I get them onto a treadmill depending on their injury. So if they're a little bit of a knee patient, I probably would start them on a treadmill, because we know that when we go up and down what we call undulating ground, hills up and down, the knee can struggle with that. And if they're living somewhere where it's hilly, I probably would say if there's a treadmill available, let's start you on that. So the treadmill's more cushioned. Disadvantage to the treadmill, because it's always propelling forward. If you think motion, it's kind of propelling you forwards. It means that everything around the back of you, your calves, your hamstrings and your glutes, are not fired up as well as they are when you have to run naturally on road. So over time, it would not be good to persistently look. If all you're ever going to do is run on a treadmill, got no intention want to go outdoors, good, start on the treadmill. But if you want to gravitate to running outdoors, you should start outdoors. So ideally that person starts running outdoors. There's so many running clubs locally, they're all brilliant. Pick up a club, get that peer support as well, you know. I think it's massively important when you're a newbie to have that support, actually.
And they range, don't they, in your sort of more elite groups to really kind of starting from scratch groups, and they're everywhere, aren't they? So, you know.
I mean, what's unique around here, I've noticed, is that they already get on as well. I'm sure, I mean, I used to run at a club and it's a bit competitive, but around here I've noticed, because I treat so many clubs at clinic, It's actually a really friendly, and they trade. So somebody who's getting a bit too quick for beginners group will join another club.
Yeah.
So I'd say to a newbie, get yourself involved with a club actually, because you just got that support and you'll get quicker as well.
That's lovely advice, Jay. And that brings us to our 30 minutes, believe it or not. How quickly has that gone?
Okay.
So a huge thank you to Jay for sharing his knowledge, and thank you for joining us. We hope you've picked up a few tips to help keep you training. And of course, if you've got a running injury that's refusing to go away, don't put up with it. Getting the right advice early is what could make all the difference. We'll be back next month for another Ashgrove TV show, and we'll be asking a question that frustrates so many people. Why do these injuries keep coming back? If you've ever thought, I fixed it this month, so why is it back again? This will be the show for you. Until then, take care, keep running, and bye for now.